My name is Dr. James Foster. I'm a retired cardiologist. My career started here in North Carolina at UNC School of Medicine, where I was on the faculty for 15 years. I then practiced cardiology here in Wake County for over 20 years, mostly at Wake Med. Tonight, however, I'm speaking as the 2017 chair of the North Carolina League of Women Voters Health Action Team. We believe that to best serve the people of North Carolina, the North Carolina Medicaid reform waiver should include a means of providing health care coverage for the hundreds of thousands of low-income North Carolinians who do not meet the current eligibility criteria of our state's Medicaid program. These people have been left out of coverage for health care. Throughout my career, I saw patients with heart failure, stroke, end-stage renal disease, mostly from untreated hypertension, diabetes, or high cholesterol. In many cases, this might have been prevented if they had been able to afford medical care. But now their lives were devastated, often in the midst of their productive years. Like my patients, most of these hundreds of thousands are good people. They're hardworking, devoted to their families, productive members of their communities. In fact, among non-elderly, non-disabled adults on Medicaid, over half, 59%, are workers. Most of the rest have been, of the other 41%, nearly all either care for family, are in school, or they're ill or disabled. And providing health care coverage to these hundreds of thousands need not cost North Carolina prohibitively. In fact, the opposite seems to be the case. In April 2017, that's just last month, a report from the Robert Wood Johnson Foundation and the Urban Institute analyzed the experience of 14 of the states that have already provided this coverage. Their analysis found that providing this coverage, quote, yielded net state budget gains with state savings and/or revenue gains exceeding the state cost of higher caseload. Providing health care coverage for these hundreds of thousands would be a win-win-win. A win for the people being covered, a win for all of us from having a healthy workforce and citizenry, and a win for the economy of North Carolina. Thank you very much.